Hi everyone, so for week two's empowerment activity, here's a graphic that I will be using in my final defense project. It is used to depict the overall proposed change. So as you can see from this graphic, my goal is to implement a compassionate pain management program for patients with cystic fibrosis and sickle cell disease. So step one will occur on admission. So at this point, staff will need to use a badge card that will be given to them before this whole thing goes live as a reminder of the CARE approach, which is the framework used for my proposed change. Additionally, each patient will receive a list of pain control options that will be available for them during their stay. So next, we will ensure to provide caring connections. What this means is that the nurse will be checking up on them every hour to see how the patient's pain is being managed. So it will be checking in, using the FLACS scale, using the numeric scale, whatever needs to be done to ensure that the patient's pain is actually being managed. At the heart of the program is the CARE approach itself. So connect, assess, respond, and empower. This approach is used to ensure that there's an open line of communication from the patient to the staff. It allows the patient to feel heard and really be part of their care. These patients have been dealing with this disease for their entire lives. So listening to them is vital to ensuring that we help them best control their pain. Some empowerment strategies will be listed on the list that they'll get at the beginning of their admission. But as a unit, we have access to the meditation channel on the TV, WeFit meditation, mindfulness applications such as deep breathing and guided imagery. So for the WeFits, we actually have 4 on the unit that the Complex Care Center was kind enough to gift us. So we definitely use those with these patients to allow them to have an outlet to try to have them have better pain control. So the goal with the empowerment strategies is to allow the patient to develop the skills that they need so that once they've been discharged from the hospital, they are not dependent on us, but they now have the strategies that they need to be successful and not be readmitted. So lastly, upon discharge, patients will receive a list of resources that they can utilize outside of the hospital. Also at this time, pre-discharge surveys will be given to each patient. So again, this program is dependent on the integration of the CARE approach into practice. Without staff buy-in to this method, this program will not be successful. So this graphic, again, is vital for stakeholders to see as it sums up the gist of the project in a succinct way to allow the stakeholders to decide if they want to take place in this study or not. So thank you. Have a good day.